This conference will now be recorded.
Kumar, sir. He's the medical director in SIIMSAR Ayurvedic Hospital, Navi, Mumbai, as well as he's the medical director and proprietor of Ambuja Institute of Ayurvedic Research and Documentation. In this SIIMSAR Ayurvedic Hospital, Dr. Dileepkumar has documented and treated more than 15,000 COVID-19 cases. That is a great achievement from the part of an Ayurvedic doctor. We congratulate you, sir, for this achievement. And further about the Dr. Dileepkumar, sir, right from his childhood onwards, he has been trained and propagated on Sanskrit language, as well as on the Ayurvedic classics by his respected father, Dr. N. Purushothaman, sir, who was a retired professor from Government Ayurveda College, Tripuntara. And manufacturing of medicines as well as cultivation of Ayurvedic plants has been there right from the lineage of his family. With all these respects and the due concerns about these crisis management, we welcome you, sir, for a great scientific discussion in this topic. Thank you so much, sir. We welcome you to the session. We can start the session.
Yes. Welcome, my dear doctors. Good afternoon. And this is a challenge, that as the presenter told, that Ayurvedic medicines cannot be used for COVID-19. But without revealing to anybody, I was just started my treatment for COVID at my clinic in Kerala and also in Navi, Mumbai. More cases I got in Navi, Mumbai. Nearly 7,900 people I have got in Kerala. Remaining people appeared in Navi, Mumbai. And I was considered it as a different context in Ayurvedic classics. Let me first read the subtitles I was about to tell today. A brief history of coronavirus to COVID-19. Categories of patient appeared for the management. Next point, different vital signs and vivid manifestations. A brief history, I'll just explain a bit also regarding the context of titles. Brief history of coronavirus to COVID. I was wondering whether the coronavirus, which was just a common cold virus, even in 1965, which was later invented as a similar virus in 2019, late 2019, and they named it as COVID-19. Then next context is categories of patients appeared for the management. Different kinds of categories I was getting, that people freshly coming as COVID-19 and with comorbidities, with the drug history of diabetes, hypertension, etc. Then again, that all I will explain you. Then different viral signs and vivid manifestations. In my experience, I will share you today. And our strategies, what was the strategy I would have adopted? Completely independently I was doing it. And methodology, it's been explained. Pharmacotherapeutics, Prayoga Vijnanam. What was my method of the pharmacotherapeutics? Exclusive criteria, whom all we have excluded from the research protocol. Posology, that is dosages with reference to different age. Then statistics in brief. Precautions taken by doctors and measures accepted for the prevention. So now let me just tell you about the categories of patient appeared for the management. On modern management, see, people after medication for COVID, how come to me like paracetamol, hydroxychloroquine. In the beginnings, people used to come with the hydroxychloroquine, then paracetamol, 650 mg, $650, and paracetamol 500 mg that they used to get from the government also. Then some people have been administered meftarmic acid, meftal. Then many kinds of antibiotics starting from azithromycin, cephalosporins, etc. So with after modern management, they used to come. Then again, people own management, like when they are on the medication, when they're not subsiding the symptoms, maybe they might have appeared to the doctor in allopathy just for a fever, then triggered it as a headache, then breathing issues, dyspnea, etc. That category, that is on modern management. Then after modern management also, after the completion of the course also, people used to get complications like breathing issues that have not subsided, anosmia, anorexia, all these symptoms were retained. Then with no modern management, people I have got who are not being treated with modern medicine at all, also I have got, but these people had lesser complications. Again, to be stressed now, with classical signs of COVID-19, with the entire signs what they ascribe for COVID-19, like anosmia, anorexia, headache, then fever, one end of fever, untimely, like Vishama Jwara. Vishama Vishama Kriya Gala Roshangava. Any time it can be triggered. Then next category I got as comorbidities, I mean existing patients. Like already I have patients now, like diabetes, hypertension. For them, they're getting COVID RT-PCR positive with antigen positive test. They also come to my clinic. Other category, unstable vitals with or without drug history. Unstable vitals like bradycardia, tachycardia, lung issues, and giddiness also was be associated in some patients. They're also with or without drug history, and people who had ENT infections were also being approached with history of ENT infections are triggered with the onset of COVID. That's also been appeared. Next, unstable, yeah. Next is the post-vaccinated case. Recently, since 1 month, I am getting post-vaccinated case also. That was also been subjected to my clinic in Mumbai as well as in Kerala, Udayamperu, my clinic. And post-vaccinated cases, many of the people used to get. You might observe patients with headache, dyspnea was triggered, brachial neuralgia. Majority of people after vaccination, they got brachial neuralgia. It was immense in nature, and they were also on management in allopathy, physician orthopedics, even neuro, gabapentin and all, they were being managed, but there was no relief for them. That case also I have managed. And many instances, people who were negative have become positive after the vaccination. Also, I have been treated after the vaccination. That's all these. That was scenario in the status of post-vaccinated cases. The patient with the premonitory signs, like simple just dullness in the head, again, no fever, but some neuropathy kind of eyeball ophthalmic headache, like eyeball pain. Many people complain more anorexia than anosmia. Okay. So next is another minority also. Nearly 25 to 30% people came to my clinic with the total asymptomatic. They were positive, but there are no symptoms. These all categories have been appeared to my clinic in Mumbai and also in Kochi, Udayamperu with COVID cases. Were all different viral signs and vivid manifestations were appeared. ICMR is saying, they say viral strains are manifesting the vivid symptoms and complications. But generally, from the beginning, they were telling that fever, anosmia, anorexia, and rhinorrhea with respiratory disturbance, especially upper respiratory disturbances. When all these generally are not found in a single individual of COVID-19 positive status. So that's how I have seen every time, person to person, the symptoms were changing. And in a single man, that's why in a single man, we won't be able to fix a standard formulation of medicament for a long time. That's why 5 days I used to give medicine based on the symptoms, but it was working very well. On fourth day itself, almost 99% symptoms were rectified. Were all 3 hours. 3 hours. It was the time that I got relief from the symptoms, especially headache and fever. Anosmia, anorexia have taken a bit more time to rectify. It took nearly 5 days to 11, 12 days that it has got the time to recover that comorbidities. Next, it is our strategies. See, in Mumbai, in 2020 March, our team have started our work immensely in the following aspects. Firstly, we have compiled the information similar to novel corona syndrome dealt in Ayurvedic classics. Then we have translated and we have referred Charaka Samhita, Brihattaris and Lekhuttaris, including this one, Vuranda Madhavam. Mainly Ayurveda Prakashika we are dependent for the combinations. Then mainly Madhavadanam, Charaka Samhita have taken for interpreting, including Ashtanga Hridayam also. For interpreting, for translating the symptoms firstly, then to interpret, and later we are documented the name to get the matching with the Ayurvedic classics. So earlier it was being named as novel corona syndrome. Nowadays I'm not seeing that people are using that word. They're using COVID-19 mainly, and translated and interpreted the treatment principles for developing treatment protocol. It's coming again in detail. Next, we have done categorized the population according to the classical signs and symptoms in 5 phases that are impressed like in modern clinical research methodology as per WHO norms. Next is enlisted 340 herbal formulations. We have got, see, we have gone through Agandu Jwaram, Vishama Jwaram, then Sannibata Jwaram, Vadika Jwaram have been considered, and unlike in other viral fevers like in Nipah and H1N1, even dengue also, arthralgia are less common observed. Many of them, the comorbidities like anosmia and bit hypoxic situations were retained as complications. O2 saturation, SpO2 saturation could elevate from 88 or 84, say. From 84 till it was, we could pick it up to 98, 99% in 3 days. But patients started to get relief in 3 months itself. Next, we are enlisted 300. When we are enlisted, when we were compiled, we had got 340 herbal formulations that are classical formulations, not by our own. 340 textual references in the form of decoctions and concoctions, and hot infusions and cold infusions, Kashayam, Phandam, Hima, etc. And the Churna Kalpana also we have got. Dealt in Ayurvedic classics after pharmacotherapeutic survey. Then I have farmers all across the country for getting the genuine resources. We have collected the raw materials from genuine drug resources in India for hygienic preparations as ready-to-use medicines, collected the data of COVID-19 patients for the documentation purpose. The methodology is literary research. As I told, we have compiled extensive literary research and developed a protocol in classical Ayurveda. Because we cannot always, it was mismatching with the modern research protocol, but ICMR is advocating. So we could, our ultimate aim is to save the public, isn't it? So I was very adamant, I was confident that Ayurveda can save. So we have depended on classical Ayurvedic protocols for interpreting in modern terms. Then what we have done, translation, interpretation, and documentation have been done. Then selection of formulations in 4 categories. That's pre-viral. We have selected the entire scenario of the individuals of COVID-19 positive cases as 4 categories. First one is pre-viral, Second is virtual viral care. First one, pre-viral care. Second category, virtual viral care. Third category is combo viral care. Fourth category is genoviral care. The pre-viral care we are given for people who are susceptible to get infections like nurses, doctors, petrol pump people, policemen, etc. We just give it as a preventive measures. Next one is virtual viral kit. This virtual viral we were distributing in the form of combination of drugs as a kit. So 5 days kit, 10 days kit. Okay, pre-viral care we used to give 5 days. Virtual viral care we used to give 10 days, and combo viral care we used to give again for 10 days. Genoviral care also given for 10 days. So now pre-viral care kit we were distributing for preventing as a droplet infection when they're exposed to the public more. It's such professionals, as I told. Second category, that is this virtual viral care is giving for people with the classical signs of COVID-19 with all the comorbidities, including respiratory distress. And third one, that is combo viral care. Usually we give it for people after subsiding the combination, returning symptoms like anosmia, anorexia, and very mild level of hypoxia, contributing respiratory distress only on exertion. So that's what we were giving for the individuals as this combo viral care. Combo means it's a combination of symptoms that are still retained after the cure of COVID-19, as evident with negative RT-PCR and antigen also. Even after the test become negative, we give this viral kit though the symptoms are retained. That's what. Next is the fourth category is distributed the kit as genoviral care. Genoviral care means lungs are the main platform for the COVID-19 is observed as affected. Here, some fibrosis or basal mosaic pattern or pneumonia, persisting pneumonia in the borderline level. Again, breathing issues, as I just told, on exertion especially, and dry cough. Again, chest pain on inspiration from the intercostal muscles. These all complications are well being managed by giving the fourth category called genoviral. The geno means the genetic picture the virus is contributing to the lungs as the organ is concerned. That's why the fourth category, genoviral care, has been distributed. See, we have succeeded in all these 4 stages for rectifying the COVID-19 complications very effectively and dynamically, and we could led our Indian public to a high potent safe zone without even they were not and even they were never been vaccinated, and they have never been reported any complications since nearly more than 1 year. I was observing, and every month I asked them to report me. Until this moment, none of the people have reported any adverse effects of medicines or COVID-19. Next is pharmacotherapeutics. The regularly see decoctions we give as classical coarse powder in sachet packets. 1/4 reduced decoctions we say kashayam, fine powder churna that can be freshly like concoctions can be prepared like how we prepare tea. Firstly, classical decoctions the patient has to prepare it freshly. Second category of medicines are this one herbal powders in the form of calca form, not Yavaguda form, nearly almost fine powder. That's for the concoction. We can say it's fanda. And tablets, gudigas, are generally have been used as conservative medicines, supported by confectionaries, abaleha. Very rarely you had to use like Dasmol Rasanam, Eladilekim, and Togeladilekim are only on requirement, or 3 or 4 days will be enough for that combinations to use. Then that all Ayurvedic classics with reference to the context we were using. That is about the pharmacotherapeutics. That's what the calculus or the forms we were giving. Exclusive criteria. People who are excluded for patients on ACE inhibitor, angiotensin converting enzyme, because I've seen a lot of comorbidities as immediately worsening the respiratory comorbidities, more among people who are consuming antihypertensive drugs, especially ACE inhibitors, angiotensin converting enzymes, or anticoagulant therapy like aspirin, clopidogrel, etc. after CAD or after stroke. Like again, like deep vein thrombosis, like heparin injected status. Again, people who are regularly monitoring with PTINR levels because of warfarin intake, that kind of people I have not accepted. Again for pulmonary embolism, people if they were on treatment, I have not accepted. Again, ILD, people with ILD on oxygen requirement. That was all. That patients also with COVID positive cases have not been accepted. Then pregnant woman is excluded. Patients on oral diuretics like furosemide, spironolactone, lactone, torsemide, and sulfatase, etc. Even people with the prostate issues, tamsulosin and all, I have accepted. But this kind of alpha blockers or diuretics, I have not accepted. You can ask me why I not later in the interaction session. Patients with a recent drug history of XCQ. At the beginning, you may be aware that entire India and even US, people were using hydroxychloroquine as an autoimmune, antidote or suppressant. But later they were stopping usage of XCQ. Okay, but people with the recent drug history of XCQ also had developed a kind of skin allergy, and also a triggering factor of fever. On fever was increased after consuming the Ayurvedic medicines. Okay, at the beginning. So from the beginning, nearly March, April time of 2020 itself, I could realize that problem with the formulary combination. So the people who had a recent intake of HCQ was also been excluded. Next, postology with the reference to different ages is given. You can just go through that. Okay, as per the age, we can. This table shows that Ayurvedic medicines can be given from infants from 7 days to 15 days till 90 years. This wide range of age groups we can give this. Okay, next is statistics in brief. Statistics, you can see, you can just go through it. We have selected 50 ideal patients exclusively affected with the corona. They were not under our medication for any other ailments. So exclusively with the corona, these people were coming to us. So 50 eligible cases, excluding all the criteria after considering the exclusive criteria, have selected for a pilot study. Then total number of people are done. 50 individuals have been selected. Patients with a totally asymptomatic were only 5. Patients with the borderline pulmonary symptoms were 20. Patients with the symptoms of pulmonary status 19. Patients with the classical symptoms of COVID were 6. A bit serious cases. In the beginning, I was saying, then the team of doctors were eliciting the symptomatology presented in all the categories for documenting similarity of COVID-19 manifestations with the different similar contexts dealt in classical Ayurveda. So age-wise distribution. Next slide is age-wise distribution for therapeutic application. Next slide shows distribution of sex among selected COVID-19 population. Next slide shows the distribution of qualitative presentations in figures, emphasizing classical Ayurveda. COVID-19 symptomatology. Inferences. The team of doctors have documented the signs and symptoms in detail by screening the severity in grades. Parameters for the grades from 1 to 4 are given below. See, we have presented the clinical signs that are not disturbing even the daily routines. Presented with the pre-monitor signs and symptoms that are not disturbing the daily routines. Presented with signs and symptoms of COVID-19 resembling with the classical Ayurvedic norms. Next, presented the signs and symptoms disabling the patient to perform even the daily routines. The grades and signs and symptoms were distributed in a master card. Then we had taken the precautions also because doctors were managing it for the precautions. So Government of India has gone all the preventive. We have obeyed all the concerns and regulations warned by the government authorities. We have disciplined. We have kept all the disciplines. Especially recommended preventive herbal formulation have been given. Shadangatwa, you must be aware about it. 1/4 reduced decoction, 100 ml thrice a day was consumed daily before food during these days of inspections for going for the rounds. Doctors were being consumed this Shadangatwa, concentrated one. And we used to give PP kits while going to the patients. Doctors directly treating the patients had one visit to the patient daily, were consumed Indugandha decoction also, 200 ml divided by 3 doses before food. With the Santhavarana, we had mixed it. Doctor who are assisting the patients for continuous hours were consumed Indugandha decoction, 100 ml twice daily before food. And the small resan also was being consumed to prevent the respiratory. As a preventive also we had given, but the small resanam I had prepared in Kerala with all the mula of the simula, from genuine regular sources. I'm cultivating it. That's I can get even the goshara mula I had used for it. Then Agis Rasanam had given, Gomutra Haritaki Rasanam also to prevent viral replication through hematological or lymphatic response. Vartman people Rasan also had been given. So now, mainly today, I just wanted to tell you some important point that COVID-19 have never been reported as a fatal situations during my entire scenario of medication. And again, none of the patients have expired. And all the later stages in late 2020, that is from August to December, I have managed the people with a bit critical illness like acute respiratory distress and O2 saturation up to 81, 82 SpO2 level also. With the hypertensive syndrome also, I have seen with people who are among ladies after hysterectomy on thyroid managements. So the complications were very very vivid, and none of the patients have expired, and all were very comfortable. Okay, and all were very comfortable. Maybe some of my patients also must be in the line so that they can also ask queries. And now I'm confident. So this is 2021 month of March. Today is 16th. So nearly 1.5 years I am managing COVID patients, and today I'm very confident to treat COVID-19 patients with my team of doctors, as I'm using genuine herbal medicines, and I was obeying classical Ayurveda with no compromise in terms of preparation of medicines and diagnosis. That's why today I would like to spend time for interaction session, so that, dear doctors, you can ask me if my patients are also in the group. You can ask me the queries and concerns. How much Ayurveda can help, and what step every government have to take. as an emergency and mandatory step for saving the innocent public, suffering public. And none of the person have led to in a bad hypoxic level, and none of the people have got disturbing or worsening lung issues. And people who have come with immense lung comorbidities, including immense hypoxia, were also being picked up miraculously in couple of days, from minimum 3 days to 11-12 days. So in this scenario, I'm requesting all states, governments, and our central ministry to consider this request with a team of Ayurvedic doctors in India for saving the panic population due to suffering COVID-19. That's why I'm very excited today to share my views on your queries. Okay, Jai Hind. Thank you very much.
Thank you, sir. And yeah, the participants can unmute and ask directly to sir. Okay, or can put their queries in the chat box. Yeah.
Some formulations which we have concluded in the mid 2020 is also I'm interested to share that also. See, we were using many formulations dealt in classical Ayurveda since 2019 December. With the mid of 2020, we have concluded to many limited formulations like Nayopayam Kashayam, Indugantam Kashayam, Mustadi Kashayam, Ashtanga Hridaya Sannivada Chikitsa, Vishamajara Chikitsa, Mustadi Kashayam, Indukantam Kashayam, Nayopayam Kashayam, Sudarsana tablet, Murtanjaya Rasam, Haridradi Churnam. So these all medicines we have concluded for distributing the 4 types of viral kits. Okay, I can tell you the combinations later if you are interested, if you want query. Okay. Now I'm inviting your queries.
Hello, good evening, sir.
Good evening. Good evening. Yeah.
Yeah, thank you, sir, for enlightening us with a new pathway. Sir, I wanted to know what we can do in a stage. Yeah. What we can do in a stage of pneumonia, sir. Pneumonia with saturation fall.
Hello, Dr. Kishore.
Pneumonia.
Sir?
Yeah. Pneumonia, usually they will have minimal level of fibrosis like LRTI, though the COVID-19 is reported at the beginning as URTI. Please. Hello?
Yeah, you can continue.
Yeah. Okay. So the medicines we are giving for pneumonia, pneumonitis, and lung fibrosis, especially worsening in the base of the lungs. The picture is rapidly responding with the therapeutics when we have given Nayopayam Kashayam. Nayopayam, it should be, the drug should be Balamula, Sida cordifolia root, and Jiraka, then Shundi. That's all. These 3 ingredients were found to be very effective to be given before food with the Shwasanandam tablet. We are preparing Shwasanandam tablet in my pharmacy, SIIMSAR also. And morning 2, evening 1 with honey. We have to triturate. Pisana chahiye. We have to triturate these 2 in the Shwasanandam tablet morning 1 and the evening. Taking followed by drinking the Nayopayam Kashayam along with the Sainthavarana, 1/4 teaspoon potassium chloride. Then people with the respiratory distress, more respiratory distress, especially disturbing the sleep at night, nocturnal exacerbation. I have given Bhagi Kanadi Kashayam before food and Nayopayam after food. Okay, so Bhagi Kanadi, you can get the reference in Sahasra Yogam. Okay, Bhargi Kanadi contains Bhargi Mula, that is Bhargi Mula, Pippali, then Kasamarda, then Haridra, Daru Haridra, Vasa, Guduji, Shundi, Dhanyaka is the ingredient for Bhargi Kanadi. Very effective, and we got result in 6 to 7 hours for the respiratory distress, and SpO2 levels also significantly improved in all the people from 80 to 83 level. It is enriched up to 88, 89 in 7 hours. Okay, and the oxygen was also removed, stored insulin, and we could stop using the oxygen also in many people. Okay, so Ayurveda can do wonders at this respect. Okay, and some doctors have used the Siddha also with the betel leaf juice and honey, but it was giving only instant relief only, but later condition was in some hours condition was coming like earlier only. But this herbal combination, Nayopayam, Bharganath and Shwasanandam, it was giving amazing results. Okay.
Thank you, sir. Bhargananda, that Kashayam is available, sir? Any pharmacy?
For Bhargananda Kashayam, where are you practicing? Where are you practicing, doctor?
Yeah. Hyderabad, sir. Hyderabad.
Where are you practicing? Hyderabad. Okay. We have the preparation. We can send it to you for such cases. Okay. We can help you, and there are some doctors who can procure our medicines. Our system is adopting many doctors in Hyderabad. We can promote through them also. Okay, and if you require also, we can provide you. We are very happy to help you. Okay.
Yeah, thank you.
Ultimately, we have to work as a team. Okay.
Yeah. Sir.
Okay, SIIMSAR will be backbone if you are do the mission, if you fulfill the mission with us.
Sure, sir. Because lot of people here, sir, suffering with respiratory distress and low oxygen saturation, unable to get the bed, high grade fever.
I will tell you, Dr. G, I will tell you another interesting scenario. See, people with the respiratory distress, I have observed people with the pre-existing illness of lung fibrosis on inhalers, budesonide, tritopramide, and salmeterol, fluticasone. These kind of inhalers, when they were using for systemic asthma or allergic asthma, bronchial asthma, something like that, people were on inhalers had more comorbidities. I think you may be aware about it. And again, COVID-19, exclusively because of COVID-19 manifestations, when a person is getting respiratory distress, it will be usually it will be usually subsided by the virtual viral care itself. That is Indugantham Kashayam before food. People with no pre-existing illness, people with no previous medications like inhalers, and people with no history of antibiotic therapy, especially SCQ like that autoimmune drug, and also again like cephalosporin. You see, azithromycin was always proven as a safe antibiotic. You know, antibiotics are good for bacteria, but they're giving it in viral infection, but is subsiding only if bacteria is involved only. But later, after the completion of the course of the antibiotic, scenario becomes again worsened. So that come with different comorbidities again. I will tell you, the people who were on inhalers for asthmatic complaints, people were on CCF for congestive cardiac failure, or COPD, or ILD, etc., had fatal comorbidities with the manifestation of COVID-19. That you may be aware, isn't it? So now these people have to treat with a lot of precautions. So patients have to be admitted, but we can treat them, we can help them. Others have subsided their respiratory distress with the virtual viral care itself. Virtual viral care contains Indugandham Kashayam before food, Indukantam Kashayam before food, Mustadi Kashayam after food. Indukantam, Pudika Dara Simula Kashaya Siddham before food. Mustadi Kashayam contains only 3 ingredients: Haritaki, Musta, and Estimatu. To be taken after food, and Musta, this one, along with Mustadi, Sudarsana tablet, and Murtajay Rasam, morning to evening one, together has to be triturated along with the Mustadi Kashayam to be given after food. With this course, definitely respiratory disease also automatically subside. We don't need to treat separately for that. But people with pre-existing illness and inhalers had led to many fatal or more comorbidities when COVID-19 infest. Understand? So for them, I have given a home remedy. You can just write down 2 inch of cinnamon, our twak in Sanskrit, cinnamon bark, 2 inch, and 4 teaspoon of coriander seeds, and 20 black pepper in number, turmeric powder, half teaspoon. These 4 items we have to crush. 3 items we have to crush, and turmeric powder to be added. 4 items together in 2 cups of water, boiled and reduced to 1 cup. After filtering through a clean cloth, not through a sieve, clean cloth without squeezing. When it is hot, warm, we have to drink like a tea daily 3 times, preferably 10 minutes before food. It was helpful in many incidences of respiratory comorbidities with the history of respiratory issues on COVID management. Okay, it's a very effective home remedy I have found. And oxygen, if people were on oxygen, like ILD issue, interstitial lung disease, and COPD cases, if people were on oxygen, very carefully we have to treat, like as I told in the beginning, Niopayam and Bhargi Ganadi Kashayam, Shwasanandam can be given for the systemic correction. It was found to be improved in 10 to 12 days. Then I used to give 1 month course after that. Then patients become completely, happy, devoid of all the signs and symptoms. Even the pre-existing illness also have been, managed very well with this medication. But only the conditions, raw materials have to be originally used. Okay, doctor.
Yeah, thank you, sir. It's really inspirational, sir, today's session. Yeah. Thank you.
Hello, doctor. I don't know if you remember me.
Yeah.
Sir, Dr. Supriya Sharma. We met in KAPR 15-16 years ago. I came with my mother, Kerala, long back. From Delhi. You met me in Delhi also, doctor.
Okay.
You came for the golden, Lotus Temple.
Yes.
Okay.
Yeah.
But anyway, so doctor, my doubt. How are you, doctor?
Fine, thank you.
Doctor, my doubt is that what about people who become COVID negative? Everything is fine. They're in the hospital. They come back, and then there is clotting, and they have an embolism, or they they die because of that. Either they have an attack, or there is, the clotting, blood clot. Like right now, somebody we know, she delivered a baby boy. Everything was fine. Suddenly, she had a clot, and she passed away. So what about the clotting? What can we do for that?
You mean dieting?
Yeah, sir. Sir, we are giving these anti-clotting, like we give, sir, for blood clot.
Yes. Yeah. Antiplatelets. You say antiplatelets. Antiplatelet agents like aspirin and platelets. Sorry, clopidogrel. You are saying?
Yeah, like ecosprin or something is given in allopathy, sir. So
I know. Yeah. Yes. Very good question.
In our Ayurveda, we have all these Ushnavirya drugs like cinnamon, and we have Dalchini is one of the good ones, and Giloy is also one of the good ones. So whatever you suggest.
Yeah. Yes, a very exciting question. I appreciate you, Dr. G. Basically, the spices we used to give in the home remedies for COVID-19 are working on the base of flavonoids and camphorates and phytosterols. Phytosterols, flavonoids, and camphorates are the active ingredients found in the experiments acting as antiviral. They also act as immunomodulators also. That's why, but the only issue is it won't rectify comorbidities like respiratory distress effectively. But when the virus replicate, when a viral replication affect a system badly, these kind of remedies may not be effective. So people who are on aspirin or clopidogrel, besides it has antiplatelets. For people, I already dealt in the seminar session that people were on antiplatelets. What we do is we just check the PT-INR level. If the INR level is maintained in the safe zone, like 1.8 to 2.1 level, that's okay, fine, no issue. But it should not go beyond 2.5, 2.4 INR. It should not come less than 1.4. So when they are maintained in that level, we can do one thing. We can just cut the dose of 1 day dose. We have to give that alternate days. For example, if the aspirin 75 at noon, if they're taking, so you may be knowing that some people take it to the statins. So we have to split it. Aspirin has to be given. We have to split the aspirin 75 or 150 mg, better in the safe zone 75 mg only. If they were taking 150, you have to taper down to 75. We have to give at noon after food, immediately after lunch. And statins, rosuvastatins, usually rosuvastatin and atorvastatin they are giving, cardiologists and the neuro physicians and CDA. So these people, we can cut short the antiplatelets aspirin dose to 75 mg to be given at noon after lunch, and statin, if they were giving, we have to split and to be given statin at night after dinner. Then if Monday, if we are given that, Tuesday, don't give that. Tuesday, the second day, Tuesday, if it's Monday, Tuesday you give arboreum plus there is a syrup. Prepare in Delhi only, it's a very efficient equivalent. Arboreum plus to be given 10 ml without adding water at noon immediately after lunch. And Swarnamuktadi tablet prepared by Kotak is the best product. Swarnamuktadi tablet, morning 2, evening 1, along with a quarter cup of jeera water. Jeera concoction. 1 teaspoon jeera in 1 cup of water, boil and reduce it to half cup. Half portion only we have to take. Along with it, 2 Swarnamuktadi at morning after food and 1 Swarnamuktadi at night after food. The days when we are not giving the antiplatelets and anti-lipid medicines. So Monday allopathy, Tuesday Ayurveda, then Wednesday allopathy, like the alternate days we have to continue. Then we have to check the PT-INR again, vital sources, BP and the sleep pattern, any other kickbacks like headache, etc. Any signs of uremia, etc. Creatinine. Usually it won't be there, but better always to check the safe zone as cystatin C करके एक test है, cystatin C, CYSTATIN space hyphen C, or nephro-C is also been referred as nephro-Z, NEPHRO space C, and EGFR. EGFR can be checked, just checked for assessing the forecast for forecasting the complications. So just to know the impact in the forthcoming complications when we withdraw the aspirin dose by giving Ayurvedic medicines. I have not, so far I have not, only the issue with the deep vein thrombosis. People on warfarin with elevated INR level, better not accept the case. Deep vein thrombosis is very dangerous to manage along with Ayurvedic medicines. Okay, hope that you again fruit, diet is very important. Egg, vinegar and dry fish. Sukha machli कहते हैं हिंदी में. So Dr. Supriya, can you hear me? So egg, totally have egg, vinegar and sukha machli, dry fish should be avoided, and all other food you can, but fruits is mandatory. Fruits have to be included daily, night before food. It's a part of dinner at night. It's a part of dinner. Firstly fruit, then followed by taking dinner. Should be better. All kinds of fruit other than sapota or chiku. Don't take chiku. Okay. Don't take watermelon. And this one Chinese orange is not good. And avoid apple for people who are taking aspirin, antiplatelets therapy. Apple is not good for them. I will tell you the impacts, and better avoid continuous intake of guava also. Once in a week, once in a week, they can have guava fruits. Better avoid taking even alternate days also. All plantain foods are very good. Robusta is very good, and lemon juice with the sugar is very ideal. Orange juice, that Nagpur orange, Indian orange, is very good, freshly, without any pesticides or post-harvest adulterations. And grape also can be taken. Okay, preferably organic one. Always fruits are indicated and advisable and found to be safe at night to be taken before dinner. Okay.
Thank you, sir. But what about people who do not? Thank you. But what about people who are not on blood thinners? Because some people, even young people, 30-year-old, after post-COVID, their doctors are giving them blood thinners. So can we straight away start them on Arborium plus and Swarn Mukta?
Yeah, people who are on blood thinners, which is recently started, can be stopped. Take them, no issue.
And
people
who have never
on
had
long-term
somebody who's not had the blood thinner ever, and the doctors are prescribing them as a just to prevent any complications, they're giving them all these blood thinners, so we can start them on this one Mukta and Arborium.
Absolutely. We can stop all these like them. We don't need to give that even alternate days. We can make them stop that, and we can daily give the Arborium and the Swarnamakta daily. But only one condition is we have to check the BTCT blood, and PTINR in the blood. Okay, and check the vitals, RR and PR, pulse rate and respiratory rate, how much is the saturation level in the safe zone. Okay, these things have to be monitored. I'd better you say them to visit once in 5 days in the beginning time for 2 to 3 visits, then once in 15 days, then once in a month. With the 2-3 months, we can conclude the scenario. Okay.
Thank you, sir.
Hello.
Welcome.
Hello, yeah, namaste, hello. Sir. Hello, namaste. Sir. Namaste. This is Dr. Madhav Burde from. Yes, sir.
Yes,
so my question.
Tell me.
How are you, sir? Fine. Sir, my question is: nowadays people are coming to us after 5 or 10 days of illness. Some people are already admitted in hospitals, and they are on oxygen therapy either, or any intravenous higher antibiotics and such things. In that case, sir, it is difficult to give amount of that much for amount of kashayas and so many amount of churnas. So in that scenario, how to reduce the doses and how to manage with minimum drug? That's the question. People almost. Yes, sir.
Fine. Very genuine question. Reasonable question. Naturally, see, in the early stages, we people were not being allowed to manage COVID cases. You may be aware about it. And from 2019 December to 2020 August, I was not dealing with people on oxygen support. But when I got confidence in treating COVID-19 cases very easily, because very rapidly we are getting disappearing the symptoms, including they're coming back to their routine. Always then from September to beginning September 2020, I started to treat people on oxygen. So we were giving instant concoctions like Bhangi Kanadi concoctions we used to give at the beginning, and Paushkaradi concoction. I can give you the formula later. Okay, concoction means like tea, they can prepare it. They can give it. Paushkaradi is a combination. It's a excellent formulation. It revitalizes the alveoli and relieves the consolidations in the bronchioles. Okay, and it provides a warmth to the lung fields as a neuroendocrine response, especially Paushkaradi Kashayam. Pushkar Muli Kashayam cultivated in the Himachal. So that medicine is very effective as a concoction. We don't need to, trouble them by preparing time-consuming decoctions. I agree with you, but they have to prepare this concoction as an instant. Like, for example, one sachet herbal powder we put in a glass, then boiling. They used to have a kettle, na? One kettle, 1 cup of water, boiling water has to be poured to the powder. So when it's cold, after filtering, we can give it. The dose is 70 to 80 ml morning, and noon 78 to 80 ml, evening also 70 to 80 ml. Okay, it was given the withdrawal of oxygen. See, the people started to become stable very immediately. And don't give Swasanandam tablet for people who are on O2 support. Okay, because it was started, it started to give pulses started to reduce pulse rate. So immediately I stopped at the beginning itself. So when I stopped the Swasanandam, pulse rate became normalized. But this only 2 concoctions we can manage 3 to 5 days. So we can stop using the stored oxygen. And 1 minute. So it was very effective for people on oxygen also, and I'm managing since September 1st week to this moment, people with oxygen support. So we can stop using the oxygen with 21 to 35 days. Okay, we can discharge the patient from the hospital from 10 to 15 days.
Okay, sir.
Okay. And here the thing is stored also that 6 hours once we need to O2 need the concentrate O2  4 liter in 22 into 4 liter release. When people were on, I saved them from that. Okay, so Ayurvedic medicines work wonderfully, and we need to explore the possibility of treating Ayurvedic medicines in intensive care units. Okay, doctor.
Yes.
It is possible.
Sir, we are really struggling the patients in COVID center or hospitals where that physicians are not allowing any external use of medicine, but relatives are convincing us to use something that will increase the oxygen level or all these things. So in that point of view, I have in that point of view, I have asked little medicine and some medicine that we have to give, which will be effective. So it was very good information.
Simple medicines won't be working. Simple medicines won't be working in cases of hospital ICU units. So this medicine only you have to convince them. They have to accept it. There is no compromise. See, we don't need to bother about resistance from the hospital. We are doing a service for our Indian public. This is the Indian system. Indian government has to authorize it. Indian government has to authenticate it. When we give a report, okay, see, by using Ayurvedic medicines, if 100 people are saved from trap of death, they should, they say it is not scientific. But when 10 people are expired while they use allopathy, they say it is scientific.
Yes.
What is this? So in this scenario, we have 100% right to ask as a citizen of India, to all the hospital authorities for helping the public, innocent suffering public. And so they have to give us consent. So we need to think as a team. Entire Ayurvedic doctors in India have to write a resolution. Okay, yes. And we have to give to the chief secretary of all the states for getting it approved. Otherwise, we need to have access. Okay, doctor. There is, and we cannot manage that kind of intensive cases, intensive care patients, just with the simple modes or comfortable, convenient modes. How they can? It's not possible, my dear doctor. These formations
Okay,
have
sir.
to be administered. No other. Okay.
Yes, sir. Okay. Thank you.
Yeah.
Thank you.
But we can support you once if you get a consent from the hospital authorities. Okay. For saving our.
Yes, sir.
We can support you. Okay.
Yes, sir.
Okay.
Sir, can I ask you one more doubt?
I'm sorry to interrupt. Sir, good evening. Myself, Dr. Ramshidhar, sir, from Hyderabad.
Okay.
See, people are, we have been, the patients have been going through many hematological investigations. Does it really make any sense in Ayurveda? Like CRP, D-dimer, okay?
Yes.
LDH,
yes.
interleukin 6, and all this. There are many investigations as well. So, is there any specific approach towards COVID patients who are in the first 5 days, second 5 days, or next 5 days? Like if it is a 15 days of illness, do we really need to check ask the patient to go through any investigation when we are only treating with Ayurvedic treatment?
Very nice. Very nice. Very nice question, Doctor. We need to be updated. We are living in modern times. We have science and technology, and now there is an ICMR. There is a health department. Okay, so Ayurveda is ancient, time-tested Vedic wisdom. So we need to update and document with the present advancement of science and technology. We shouldn't be against it. But our medicaments and recommendations in the form of diet and also medicine, how to be on the basis of course, in our classical Ayurvedic norms. I do agree with you, but we need to document it. We need to materialize Ayurvedic in modern times. Then only we will get acceptance nationally and internationally. That is why every 5 days, as you suggested, it is always good to have hematology investigations. CBC will tell you the impact which I have observed in the hematology investigations are lymphocytes usually will be more than neutrophils when they come to us first with the allopathy managements or without allopathy managements. And ESR will be elevated. We can just record it. We can just document it. How much lymphocytes could have become proportionate with the neutrophil, and ESR is reducing. Again, CRP, cytokine storm. How much we have to get one. We have to get one document. CRP level, how much it is reducing in short span of time. 5 days is very short span, but our medicines could reduce the cytokines storm drastically, and also CRP also could reduce with no time, like faster than allopathy medicines. Again, people who are coming after allopathy medications, we need to check the creatinine and LFT. Okay, in liver function tests, see, people usually are coming to us after allopathy management by taking this one TDS $650 or one BD $650 paracetamol, augmenting with the potassium clavonate, doxycycline usage, this one moxiclave, again augmentin, okay, with the potassium clavonate, cephalosporins, all kinds of antibiotics. There might be antihistamines, levocetirizine, montelukast. All these long list of medicines which they used to give in the hospitals can create some impacts in the body when they come to us. So before you start the treatment, better you just have a hematologic investigation for safety, for being in safe zone. Why? Because tomorrow they may say the SGO2 STPT level is increased because of Ayurveda, and creatinine increased because of Ayurveda, and urea increased because of our problem, hematuria. Uric test also have to. So you need to do all the investigations before you start the treatments in Ayurveda, so that you can claim. If they go to court, if any minister or if any secretary, if any bureaucrat say that Ayurvedic medicine cause problems, we can claim that it is not causing. Understand? So
yes, sir. Yes,
it can happen. It can happen. So more frequently it can happen. Public is also waiting for dename our classical system. The tendency is more as they are proud with science and technology advancements. That is why at beginning we need to check all the mandatory tests, including CRP, RT-PCR, throat swab, and so-called oropharyngeal and nasopharyngeal antigen test. Everything you need to check. Fifth day, you again do the check. Only necessary things like CRP. You can repeat RT-PCR, and antigen test also you can see. ESR only, a CBC also. At least that you do. Okay, CD4, CD, IL6, IL4, CD4 is very expensive. You can do it once in a month. Okay, the basic test you need to, and again, lung X-ray mandatory. CT scan if possible. If they can afford the CT scan, better you do CT scan before and after 15 days or 1 month after our medication. It's a complete tomography. CT scan, better if you do a spiral CT scanning. Okay, better not do any dyes. Okay, because we need to rule out only this one fibrosis or cystic fibrosis or any history of sarcoidosis, which is triggered or not. These things we can make use of. I mean, this information will be helping us. Again, if they had any issues with the liver, SGOT should not be more than PT. When they come to us firstly, SGOT should not be more than PT. The normal range is not a concern. For example, people with elevated liver enzyme 70 and 90s, you don't need to be panic. But if it is though in the normal limits, if SGOT is more than PT, it indicates steatosis hepatitis. It could be usually drug used for modern medicines. So that scenario we need to look after. Then you do the treatment after 5 days. LF you have to repeat how much you could reduce SGOT less and STPT more in 5 days. Perfect. In case if they had any issues of hepatic cirrhosis or any cholestatic or gallstone history, that also can be rolled out in an ultrasound scan after 15 days. See, when we do treat, you just go through all the investigation, emphasizing the pre-existing illness also. Okay, doctor?
That's very
so we should have all the documents. That's all right.
Sure, sir. Thank you.
Sir,
one addition to this question. Are you there are many parameters as such you have explained hematologically.
Yeah.
If they are in rise, are you treating 1 by 1 or 1 to 1 like approach, or how do you treat usually? What is your mode of approach?
See, very good, very good. See, patients are presenting signs and symptoms. We are eliciting the case. We are treating the symptoms. The values and documents in the form of films and papers are a matter of documentation only. We should not lose our logic thoughts. We should be always emphasizing the presentations. So how much in terms of qualitative presentations, how come to normal, the lab investigation, the grading in the scan, everything can be considered as a quantitative measurements. Whereas we need to focus more on qualitative presentations like pain, diurnal variation of fever, appetite level, and constipation, loose motion, and ophthalmic headache, fever, character fever, again, rigors and chills, rhinorrhea, respiratory distress. Okay, all these signs and symptoms have to be accounted. And in every 24 hours, we need to have a checklist on how much it is reducing. In 5th day, patient has to get 90% relief, no compromise. We can get it.
Okay, okay.
So qualitative parameters we need to focus. If we do, we can have a lot of formulations from our treatises. There is no, as you said in the first question, there is no medicines in classical Ayurveda written in Sanskrit for ESR. There is no medicine. Understand? So we need to coins. We need to, we need to interpret or translate in terms of classical Ayurvedic classics, like disease context like Agundu Jwaram, the Tandraka Jwaram. Okay, so Sannivada, there are 2-3 types of Sannivada Jwaram. Again, that all have coming very much resemblance with the so-called COVID-19. Again, see Sangarama Jwaram, Makari, Vithomsi, Karkoda, Kashapa Samdha. Again, interestingly, I will tell you one more thing. You might be already learned in the BMS course. I will tell you it's loka. Prasangat, Gatra Samsparshat, Niswasat, Sahabhojanat, Sahashayasana Chabi, Vastramalya, Anulepanat. See, how many means are told as the means of transmitting the diseases as a droplet or contagious. Modern medicine have not explained that much of means of transmissions. My dear doctor, are you listening what I'm saying? See, Ayurveda has explained more means of transmitting Sankramika Rogas. Again, Kushtam, Jwaram cha Shoshtascha. Jwaram again mentioned already in it. Kushtam, Jwaram cha Shoshtascha, Netra Pishandamevacha. Aupasargika Rogascha, Sankramandi, Narad Naram. Okay, so this is a very beautiful sloka. Janavada Thumsadhyaya also, you can compare some of the Jaram Kara Agashvaya Dushti, Chadurvida Bhava, so that people can look after. Again, there are many contexts causing massive death, leading to respiratory distress followed by a fever. Different kinds of Aganduja Jwaram written in medieval period, 9 AD to 16 AD. When you have done the literary research, we could find that context. It was very interesting. So we have to make use of our Vedic wisdom to serve the world. I know the limitation of modern medicine. Understand? But we need to prove the efficacy and integrated management to save the innocent public, suffering public. Okay, doctor?
Yeah, thank you, sir. Thank you. And one question here asked is the concern for children. So, kindly suggest the preventive measures.
Yeah. Doctor, preventive measures, please don't say Ayurveda is preventive. See, already if the board, if a person, Mr. A, if he has not infected with the corona positive, what it indicates, since 1.5 years, when a man is not infected with the COVID-19, why should he need preventive measure? Common sense, you think. So his immunological status, okay, he is competent. And again, I shouldn't have told this, but I'm just revealing a fact that whenever I see patients with the COVID-19 patients are sitting right to me, I never wear mask, my dear doctor. Can you listen me? Okay, in Mumbai and Kochi, in the first 2 to 3 months, I was wearing mask. I was wearing all the PPE. It was disturbing me a lot. Since 2020 June onwards, I stopped using mask. I stopped using PP kit. Until this month, every month, twice I am checking my RT-PCR. I have never become positive. My antigen is also non-reactive. Understand? So, what it indicates, I don't need preventive measures. But among children, this one example, I just wanted to so I was ready to sacrifice my body because people, authorities and even Ayurvedic doctors, allopathic doctors, my relatives, my friends, colleagues, everybody were torturing me. If you are treating COVID-19 patients, you will be infected and you will be no more in a couple of days. It has never happened. Sorry, I shouldn't have told this. because the present scenario of panicking the population entire world. But I am telling you, as I experienced my body for this mission. Anyhow, let it be one side. I'll answer your question to now. Preventive measure. Every ministry in India, state ministry and central ministry, always they are fearful to say conservative management in Ayurveda. They always want Ayurvedic school of thought to say Ayurveda as a preventive measure only. Yesterday, the CM of Kerala, yesterday the Chief Minister of Kerala, he's also saying Ayurveda is good. Ayurveda is a good preventive for COVID-19. What is the preventiveness? What is the preventive? Why should our ministry itself sideline us? So I'm telling you, I give among one preventive medication for children as coriander seeds. Everybody I'm doing, you please note down this. Coriander seeds already done in the WhatsApp to many groups. Coriander seeds, 4 teaspoon, and fenugreek, half teaspoon, turmeric powder, half teaspoon, star anise, 2 in number, black pepper, 20 in number. This is a fantastic home remedy, can be acted as a prevention. It is already time tested. Okay, it is being given in many housing colonies, Bank Employees Association and Residential Association. Then again, my patients. Do you know whom it is to be given? People who are residing along with COVID-19 patients in a home. This performance can be given. All these spices.
Sir, can you repeat this again?
4 teaspoons of coriander seeds. I am repeating now. Okay, 4 teaspoons.
Please repeat this again.
4 teaspoons of coriander seeds. Yeah, I'm repeating. 4 teaspoons of coriander seeds, half teaspoon of fenugreek, methi, 20 black pepper, half teaspoon of pure turmeric powder, should not have any adulterations, and fenugreek, then star anise 2, fenugreek half teaspoon, turmeric powder half teaspoon, coriander seeds 4 teaspoon. 5 items, is it over? 5 items. Totally 6 items. I will WhatsApp you. Okay, I have the formulation. Coriander seeds, black pepper, fenugreek, star anise.
It's only 4. It's only 4.
Yeah, black. I will repeat again. Coriander seeds, fenugreek, turmeric powder, star anise, black pepper, and one more.
Small
is
onion,
there.
sir.
Shallots, sir.
Small
Yes,
onion.
small onions. Yes. Some. Yes, you're right. Yeah. Small onions. Two small onions. That's enough. You are right. Absolutely. These 6 items we can give after crushing these boiled in 2 cups to 1 cup. After without straining, we need to filter with a cloth, not with a sieve, as I told earlier. When it is hot, we have to give it 1 cup egg them at morning. For elderly people like that, every time we need to freshly prepared. It need to be prepared freshly. 1 cup morning, 1 cup noon, 1 cup night before food. And among children, half of the dose, half cup morning, half cup noon, next half cup evening, half cup at night before some light food at evening. Okay, this is the course is 5 days. It has been, and all bureaucrats and government authorities are streamlining Ayurveda like this. But Ayurvedic medicines are intended for doing conservative management, Shamana Chikitsa. So we should not accept their versions as Ayurveda as a preventive thing. Ayurvedic medicines are not preventive, they're curative. That's what I was trying to prove since 1.5 years by making documents, my dear doctors.
Yes, sir.
Okay.
Yes, sir.
Sir, I also have another doubt. What about using Nasya as a preventive as well as a curative thing along with the Shamana Chikitsa Aushadhis? Because I have been getting good result with that. So I just wanted to know.
Anutailam?
Yeah, Anutailam. But so I've been for preventive as well as treatment, where whatever medicines you're giving along with that, if you can tell them to do Nasya also. So is it any benefit in your research?
Definitely benefit must be there, but two conditions. Nasya should be Prathamashtha Nasyam, 2 drops east to east nostrils, and followed by they have to do Gandusha with the warm water.
Okay.
They
And
do
Dhumapana
Asanchari
with
Gandusha.
Haridra?
Don't say
Sir, Dhumapana with
Dhumapana, of
Haridra?
course, but yes, doctor. Dhumapana is very good, but the problem in rainy season, better avoid it.
Okay.
When it is heavily raining, avoid Dhumapana. It create a vascular headache in long run.
Okay.
And Dhumapana, you can use the herbs like Jadamansi, Agaru, Gugulu, Haridra Churnam, 4 items. It is very good for treating mucormycosis induced by steroids and O2 supply. Please note this. Nowadays, it's becoming very important. I will repeat this formulation again. Jadamansi, Agaru, then turmeric powder, Haridra Churna, and Gugulu. Gugulu shows that the Gugulu is the form of powder. These 4 items sprinkled. You might be knowing the preparation of Varti, isn't it? After dipping ghee, but letting minimum 2 minutes. After turning fire off, in 1 feet, I would say 12 1 centimeter above mouth. 1 centimeter above mouth opening. Niche in the diameter of the funnel of Dhumapana Yandra is 12 centimeters, and the height is 12 angula. 1 angula is 1.2 centimeters. Height is 12 angula. Diameter of the base is 12 centimeters. Upper mouth opening is 1 centimeter, so that the smoke coming above will be saturated or carbon free with full of flavonoids and phytosterols through fumes, devoid of this one carbon contents, so it won't be harmful. All right, and 3 times east to east north, that is the ideal time. 3 times alternately, right, then left, then right, then left, then right, then left. The exact 3 times alternately. All right.
Yes, doctor. Thanks for simplifying.
Most welcome.
Sir, regarding the documentation,
Any other queries?
What are the measures you did?
Regarding
the documentation.
documentation.
Yeah.
Documentation. See, firstly, I already told you regarding the literature survey, and we are equated with the symptom-based Vedic context interpretation. Then we have made this one summarized the inclusive and exclusive criteria. Later, we have developed a protocol as Samana Chikitsa, 5 days, 15 days, and 1 month. Okay. Based on that, we have indicated that for hematological investigation, X-ray, scanning, RT-PCR test, antigen test, maximum of the possible extent in investigation we had promoted, but the patients were taking money from their pocket for doing the examinations and investigations, and in very many instances, I used to pay money from my pocket if the people are very idle for the research and if they're poor. Okay, so nearly 3 some lakhs I have spent from my pocket for getting the test, and if the people want to be poor, other groups they when I felt that test was mandatory, I was investing, happy to do the test, money for them. So anyhow, we had got all the documents. Caliber. Can get me? Okay, that's how we have done it, and it was a long time of nearly 1 year, 2 months. We have done it, but we were doing it confidently because those times ministry and even bureaucrats were not letting us to do with our freedom. So otherwise there was no option on those times. If we had not started it, it would not be a, now if we start, what is the use? Meantime, how many people expired? So we could save a lot of people, thousands of people. Okay, and this was the method of documentation, doctor. Okay, and age-wise, caste-wise, food habit-wise, and severity-wise, and vitals instability-wise, we have categorized and made the graphs for the documentation. And the pre-existing illness also have been accounted, but it was not present in the today's presentation. Pre-existing medication like diabetic people with after COVID-19, hypertensive people on medication allopathy affected with the COVID-19 population. All these have not included. It was a very complicated topic, but it is there with us in our MasterCard. But it was not been published. It was not. And again, I will tell you another interesting point, my dear doctor. People on AC inhibitors for hypertension had more comorbidities in the landfills after the attack of COVID-19. Please note this point. And many people who are hospitalized, when they informed allopathy doctors, my friends, when they telephoned me, I told them to switch over the from AC inhibitors to beta blockers. Immediately, it was rectified again. People with after vaccination, many instances people had similar attack like MI, but it was not MI. Picture was ECG picture was showing MI. Later, when this then the CT scan was lung fibrosis, lung consolidations, contributed hypoxia to the cardiac coronaries, cardiac muscles. So that situation, after switching over the AC inhibitors to beta blockers along with O2 supplements, will definitely save the people in emergency. So it was also a part of observation which I had in many instances, people on AC inhibitors when they got COVID-19. So that people also later came to me for Ayurvedic management, and slowly in some couple of months I could stop even the allopathy medicine for BP. I think many of the doctors might be knowing that I'm a person who stopped allopathy for lifestyle diseases. Even by stopping Ayurvedic, I'll be continuing them. I'll be letting them free from the medication. It's my mission. So anyhow, with this opportunity, but destiny has given me, I could do that. Okay, doctor.
Okay, very good. Thank you. And one more thing, how you compare the first wave and the second wave, which is recently origin? So, what's the differences you feel?
Dr. G, it's a very controversial question and a very confusing question, and very complicated question, of course, because first wave and second wave, there is alarming difference. Second wave is more alarming, usually manifest after vaccination. That's what my assumption is. And first wave, I don't feel COVID by itself is causing all this, because usually coronavirus have a lifetime of 8 months. In all the countries, they let the citizens free after 8 months. In India and some other countries in the world, they enforce vaccination and they have no definition and no clarification in many queries. So after this, this second wave, when manifested, it is more with respiratory comorbidities and acute dyspnea. So the first wave was very safe, and it was just disturbing the people with the pre-existing illness like COPD and ILD or systemic bronchial asthma, etc. On inhaler or without inhaler, if they were on oral medication, it was triggering with this attack. But this scenario, second wave, is more alarming, leading to unstable vitals, including the requirement on oxygen supply drastically. And I have found it after the administrative vaccine only, we need to have a truthful explanation from the authorities. They should explain whether the COVID-19 has a tendency to trigger by its own replication by developing new strains manifesting this kind of respiratory distress. Nobody knows exactly what is happening. Okay, and TIF and TNF, tissue inflammatory factors and tissue necrotizing factors, are generally leading to comorbidities as lung consolidation when the second wave manifests. That's why lung, majorly people are getting irreparable damage to the lung tissues. So this status also, I do treat. Classical Ayurveda can save even that status. Okay. And now I'm managing since 1.5 months. I'm managing that school of people also. My team in SIIMSAR also. We are happy in doing, and we are not panicked now. We are confident. But nobody is leading to more worsening complications until now. Okay.
Okay. Thank you, sir. So
welcome.
So in the post-COVID management, it's another subject. So what we can essentially do.
Post-COVID complications, I will tell you, see, some people can have some complications like anosmia. It may be retaining, anorexia. General anorexia naturally subside in a couple of days, like 15 to 18 days. But anosmia in some people will retain. Again, dry cough. Dry cough will be there. Some other people, headache on strenuous reading or computer, seeing. Again, some people got cramps at the nights in the calf muscles. And some other category people, they get hyperglycemia. Even the people who are on medicines or insulin, with this attack of second wave, even the sugar is not getting subsided, which were subsided with the previous medication of diabetes. Even insulin is not working out. It always shown in many instances I have observed. I'm a diabetologist also using Ayurvedic medicines. So 90% of the people in the second wave have increased their fasting sugar by retarding the glycogen storage capacity in the liver. So it's also another observation which I had in the second wave. So these all we can manage. Are you interested if I say one by one?
Yes, sir. Please go ahead. Please.
Okay.
Sir, and start off with anosmia, sir, please. The basic, simple thing, and then you can go on.
Sorry?
And sir, also, sir, start with anosmia, like different symptoms. What are you giving? Anosmia, and then sir, increased uric acid because of using antiviral. Sir, in post-COVID complication, the uric acid have increased because of a lot of antiviral medicines like Fabiflu. So for that also, the kidneys are getting affected with the medicines.
Kerala, very rarely doctors use antiviral drugs. And Kerala doctors are very smart. They carefully deal the patients. Even IMA in Kerala and medical colleges and many community health centers, they do very safely. They manage. Still, antiviral drugs they use in the beginning stages, the late 19 and mid 20s. After I feel many of the doctors are not using antiviral nowadays. So I'm not getting cases after them. So I was not getting early stages. See, antiviral drugs, that kind of side effects like uremia, we may say. I don't know whether that antiviral drugs leading to that kind of side effects. I don't know, Dr. G, but we can manage that. Okay, we can manage that. Serum uric acid increase level. It's again it's a metabolic issue. If the patient has a history in the earlier stages, if they were controlled it, if they were controlling it by means of, we say, anti-uric acid drugs, what is that? Febuxostat, and one more drug is, forgot its name. So when they were on that, usually they don't take regularly. So when they stop using anti-uric acid drugs, uric acid increases, become uncontrolled. Unfortunately, with the background of COVID-19, we say it is because of antiviral, but exactly I don't know whether it's because of antiviral drug. Whatever may be, we can treat it. Okay, Kallur Vanchadi, there is a combination with the panel vere and Avibhatha Churnam, Kallur Vanchadi Kashayam with the panel vere. It's a herbal formulation, 100 ml 2 times before food, matter of only 20 days of medication, and pure Avibhatha Churnam at night after food.
So can you repeat?
Pure.
So can you Kallur Vanchadi? Kallur Vanchadi
with the panel vere. With the panel vere. Panel means in Kerala, many of the Malayali doctors may be knowing, it is Glycosmiss pentaphylla. Glycosmiss pentaphylla, botanical name. And Kallur Vanchadi is a very beautiful yoga, that is Sastra Yoga. Okay, we can get it for you if you have got a patient like that. And Kallur Vanchadi Kashai miraculously work in 72 hours. On 4th day, uric acid becomes low. 9 point something becomes 7.2, 7.4 range in 4th day. And with 20 days you complete, and no other medicine is required. Arigorthini tablet you can go ahead, you can give, but you have to prepare genuine medicine. Arigorthini resam, Arigorthini guliga. At morning only 2 tablets along with a quarter cup of water immediately after breakfast. 2 tablets, Arigorthini tablet along with a quarter cup of boiled and cold water. We have to triturate to be taken at morning after breakfast. If the uric acid is contributing pain, I am saying, better avoid painkillers in Ayurveda or allopathy. So uric acid elevated, there is no necessity for causing complications like gouty pain or stone, etc. Okay, in that instances we need to do that treatment. But if there is no other complaints other than mild pain but elevated uric acid in the blood, this combination can be given ideally. Okay.
Okay, sir. What about the anorexia and the anosmia?
Anosmia.
Oh, we will come back to that. Okay. Because of this uric acid question, I forgot that. For anosmia, we can give Pathya Shanagam Kashayam. Pathya Shanagam, but it should be coarse powder, classical form. Don't use preserved decoctions in the bottles. Pathya Shanagam Kashayam, 200 divided, see, 30 grams of sachet packet, boiled in 800 ml water to 200 ml. We have to filtrate. That 200 ml has to be given in 3 equal parts, morning, noon, and evening. 200 divided by 3, half hour after food. Along with this one, Lakshmi Vilasarasam and Sudarsana tablet, 1 TDS, along with the tablet. Okay, and tablet Biogest is there. Biogest prepared by Kerala Ayurveda, Exitox is also Biogest PAOGEST, 2B, another beautiful medicine. Before food,
the medicines for
yes, anosmia. I was
yeah.
Now about anorexia. Okay, anorexia we can treat with Gandharva Hastadi Kashayam. Gandharva Hastadi Kashayam, 100 milli 2 times after food, along with 1 Yagrdari Loham each. Yagdari tablet, one morning, one evening, along with the Gadravasta Kashayam, with the Santavalapanam and Hindu Vajandi Churnam. Hindu Vajandi Churnam at two in the form of tablet, if it is there, 2 tablets or half teaspoon Hindu Vajandi Churnam at noon, along with the lunch. This will be enough. And again, we have a good medicine in the Himalaya, leaf 52 DS, 1 BD, leaf 52 DS, 1 BD only after food, immediately after food, the morning and evening. It must be more than enough for anorexia to manage after post-COVID complication. If it is still retaining, the course we can give for only 10 days. That's enough. Anorexia is also, I give only 10 days. That's enough. Anosmia, I'm sorry, anosmia. Anosmia, anorexia, both these situations, this medication can be continued only up to 10th day. That's enough. And Thumapana, the Nasya and all are not required to continue. Okay. And many instances, we can wait up to 1 week after completing the course of COVID-19 for natural restoring the smell and taste. If it is not, after a week only we need to start the treatment. Otherwise, please don't. Naturally, it will get that always that healthy. All right.
Next one is general debility or weakness. Post-COVID, general debility or weakness. How to treat?
General debility weakness. Very good. See, we can give Agastya Rasayanam. I will give you some people who are diabetic. This cannot be administered. Non-diabetic people can. I will tell you the list of medicines. Agastya Rasayanam, 1 teaspoon morning, 1 teaspoon evening. Slowly melt in mouth, followed by drinking warm water. Half hour after food. Okay, or ashwagandha with kapikachu and haridra churna. Ashwagandha, kapikachu, haridra churna. For people in above 50 to 80 years. Okay, so 50 to 80 years we can give this powder, 1 teaspoon along with the milk at night while going to bed. Okay, and again, fruit therapy is always better. Pineapple, papaya, muskmelon, and any one of the plantain fruits, banana fruit, pineapple, papaya, muskmelon, and any one of the plantain fruit. Equal quantity cut fruits at night before dinner, preferably, can be given. Okay.
2 more post-COVID symptoms.
Of course, 1 month can indicate, but Chavanaprasha can be given. Chavanaprasha, but it is very difficult to get genuine Chavanaprasha. And for diabetic people, we can use Nadi Kashayam at at night after food, or Drakshadi Kashayam. Warning, there is a sugar. I am using Drakshadi Kashayam and Mridvigadi Kashayam and Ushiradi Kashayam for rectifying the fatigue and lethargy after diabetic people. Mridvigadi Kashayam, Drakshadi Kashayam and Ushiradi Kashayam. Raktapitta Chilsa can be adopted. Just a matter of 20 to 30 days I give, preferably after food. Okay, and naturally, see, when we manage the COVID-19 Ayurvedic medications, all this will not be required. They become much refreshed with the completion of COVID-19 course itself. We don't need to separately treat for it. But people after other medical managements, when they come with lethargy and drowsiness, including body fatigue, we can manage this way. Okay.
Sir, 2 more post-COVID symptoms are there. One is costochondritis or non-specific chest pain, and second one is people are complaining that thermodysregulation. So
Sorry?
post COVID, thermodysregulation, exertional increase in temperature. If patient after post COVID, if patient do any strenuous work, then there is increase in temperature. So this is somewhat thermodysregulation. So how to think and how to treat?
Yeah, actually the second context I'm not getting as a manager with Ayurvedic medicines, but I can suggest you Pachanamratam Kashayam now, Amrtadi Kashayam, Delta Shastra Yoga, Amrtadi Kashayam or Pachanamratam Kashayam, and Amrtarishtam. Guduji preparations can be good. Guduji Sattva, Guduji Sattva you can use at nights, or it should be original, not the Godanti Hasmam, pure Guduji Sattva. Or Pachanamrata Kashayam alone, and Vilyuadi tablet. Vilyuadi tablet, best quality Aushadhi. Kerala Aushadhi is good quality. Morning, noon, evening, one each, along with the half teaspoon of ginger juice and 1.5 teaspoon of honey. Pieces triturate karke, just all this one taking, followed by drinking half cup of boiled and cold water. Matter of 5 days. Usually that temperature regulation variation can be arrested on exertion, especially as you said. And the other one you are telling about costochondritis. It is very less common in Kerala, I found. Usually it was observed more on dengue and H1N1 cases. Okay. And people with the history of periarthritis or with the history of dorsal spine neuralgia, or with any other comorbidities, including history of trauma or RT, etc., can have a costochondritis. And again, with the uncontrolled cytokine storm, when the cord was affected, more the when become a bit uncontrolled. In some people, as you said, it can retain this kind of. It can leave this kind of costochondritis comorbidities. We manage it with the Bella Coranda Muladi Kashayam. I have got cases, but bit rare. A monthly 2 or 3 cases I used to get. This one, costochondritis can be effectively managed by Bella Coranda Muladi Kashayam, 100 ml BD before food, along with the Vittamaran, morning to evening one, along with the Kashayam. And there is a Nagarjuna tablet called Spondylon. Spondylon, Spondylon, morning to evening to before food, and Panion tablet. Panion, P-A-N-I-O-N, plain, don't use Panion plus. Just plain tablet Panion, morning one, evening one after food. So Spondylon, 2 BD before food, Panion 1 BD after food. With the Bala Coranda Muladi Kashayam. This can be used Bella Corona Muladi along with the Vittamaran 201. It can be used for all age groups, but people with the post-hysterectomy status, ladies with the post-hysterectomy status in between age group of 40 to 60 can have costochondritis. Very difficult to manage, very difficult to manage because I have tried. It is not getting remarkable relief. Okay, other class of people, I am getting good result. Okay, and I don't know why among them it's not getting rectified. Okay, maybe we need to analyze more on it. Okay.
Okay, so in mild symptoms like sore throat and a small fever, if for doctors or for other patients, so what do you suggest? Go for an RT-PCR or going with the Ayurvedic medicine? So initially.
Very good, very good. See, when people get sore throat, you just better not go for RT-PCR at the beginning itself. Just let them have a trial of one warm concoction in the mouth, kabbalah. That is, I will tell you, turmeric powder and lemon and ginger. We have to boil. Are you listening? 1 inch length of ginger, 1/2 of a lemon, 1/2 of a lemon. Don't squeeze it. half of a lemon, 1 inch of ginger, and half teaspoon of turmeric powder with quarter teaspoon of crystal salt. Not that is the powder, crystal salt, quarter teaspoon of powder. All this together just to make concoctions, okay, and do gargling morning and evening, preferably 1 hour before food. Don't give it at the bedtime. 1 hour before food, preferably we use it. Just matter of 3 days, 4th or 5th day, let them go for RT-PCR without doing. Only 3 days let them do. Once for 4th or 5th day, anytime they can go for the RT-PCR. Meantime, this problem might be rectified. If it is not rectified, they can go for a RT-PCR if it is necessary. Okay, and anti-test socially we can recommend. Okay, sore throat, see, it can be because of other influenza virus also, not necessarily because of a COVID-19. Because of the immune defense response, these symptoms have been limited in that level. When the viral crystals have been settled in the throat folds, especially the posterior pharyngeal wall. Okay.
Okay, thank you, sir. And one thing you already mentioned that you are having fresh, you are giving the fresh medicines, that fresh drugs and fresh medicines. So
yeah.
And you are not using any bottled kashayams like that. So we need to explore more regarding that. Okay. So how they also asking, one person is asking how to get it from you, like that.
I understand.
Question is all.
The bottle decoctions are good. They're good. They're not bad. The companies are strenuously preparing it, but ready-made decoctions are more potent, and we have to manage the critical conditions. We have to use that freshly prepared decoction only, because the expiry standards of raw materials, the original resources, we need to be very keen in collecting the raw materials. First thing to be done. Second thing, I am the medical director of SIIMSAR. You may be aware about it, and SIIMSAR is supporting the doctors of entire India for equipping to have a competent medical practitioner to meet the challenges of present health scenarios and issues, burning issues of the public. So now, people are not serious about Ayurveda, and people won't sell it as a first adoption Ayurvedic practice for any illness. This is a problem with the society. So it will always be comfortable and convenient for giving medicine in the ready-made form, like bottled decoctions. But some challenging cases like hypertension, CVA, CAD, and carcinoma, and prophylaxis and conservative management of COVID, as we said, we need to use coarse herbal formulation dealt in classical Ayurveda. None of the medicine is there with my own. I don't formulate any medicine. I am just obeying our Vedic wisdom with full of honesty and trust. So this medicine I am cultivating all across the country. Okay, I'm using organic manuals, and I'm entertaining only organic cultivation among farmers all over India, nearly 22 states in India, since 19 and a half years. So I have all the raw materials available, including rarest Himalayan drugs, and I am specialized in Dileepkumar only. Okay, so if you want, SIIMSAR can help, and I am actually having one research documentation center in Kerala, which is running more than 20 years. And now SIIMSAR is my dream project, but I'm doing a service. So this is not only for the patients and people of Maharashtra, it's also for entire Ayurvedic doctors in India. So please make use of the services what SIIMSAR is offering. So they can supply you, they can give you for challenging diseases. SIIMSAR can supply you medicines for challenging illness and this kind of COVID-19 challenges we can meet if we use genuine medicines. So if you are interested, we can visit my farms also many places in India. We can make a group for traveling after this COVID burning issues. Okay, so later we can plan for a trip also to my farm so that you can see what I do, and you can see my web channel. I have a YouTube. You can type classical Ayurveda series, AIARD, classical Ayurveda series. It's my own YouTube channel. You can visit me my farms in the YouTube. Okay, and website is also there. SIIMSAR is also having now. SIIMSAR is doing that services, as I cannot do personally from my farm in Kerala, but I am supporting SIIMSAR for doing the service for our enchanting Ayurvedic doctors in India. Okay, ji.
Thank you, sir. I think our time, our time is over, but so many questions are there. So what we can do, we'll provide you their number or your email ID so that they can discuss with you, I think.
All right. Thank you for giving me this opportunity. And my old students I could meet. I was very happy. And Madhav, Supriya, I'm well known to them. Very, very happy to meet them again after a long time. Let God bless you. Let us work as a team for the national dignity and the renaissance of our Vedic wisdom. Let God bless you. I'm always with you as a backbone. We'll move together, my dear doctors. Okay. Done.
Yeah.
Take it.
Thank you. Thank you.
Welcome.
Sir, YouTube channel, please repeat, sir, the YouTube channel.